Hey there, we are Between Two Teeth. I'm Bobby.
What's up?
Who are you?
I'm Steffi Stuck.
That's right. This is kind of a special edition. We're going to talk about a bunch of things. We are speaking at the American Association of Oral and Maxillofacial Surgeons Dental Implant Conference. We're talking about digital dentistry, dental aspects. We want to talk about that, and we want to talk about how fun it is to work with an oral surgeon as a periodontist.
And vice versa, what it's like as a periodontist working with an oral surgeon.
That's right.
Let's get into
oral surgery. Digital dentistry first.
So digital dentistry, what we just presented on at this AMOS conference was guided implant surgery, and that's you have the static and the dynamic guides, and that's where everyone's kind of moving towards and have been moving towards. The cool thing about the what we're talking about is the business aspect of it. Can you incorporate this in a predictable way into your practice? You just finished your MBA. So it was kind of a cool thing when you look at systems and then you look at technology. Yeah. And I actually just read something in the Wall Street Journal talking about tech and debt don't mix if you look at crypto at all. So having good systems in place, knowing what kind of tech you're getting into, and having immediate productivity from it is important.
And I think part of what we tried to do during the lecture was set appropriate expectations. The system we use is what?
Oh, we use XNav, and the specific machine is called XGuide.
And so it took time for us certainly to integrate that into our system. And from an operations management, there were some nuances. It took a fair amount of onboarding. We're happy where we're at, but certainly took a little bit more time. Let's pivot. Let's get into how wonderful is it for a periodontist to get an opportunity to work with me as an oral surgeon.
Let me stop you right there
and be nice about it. I can hit the stop.
So part of how this works is and I mean this in all totality, is that you have two people with, you've got an ego, I think I can say. I've got a humongous ego.
You do.
Yeah. And so what we've had to do is just recognize that both of us think very highly of each other and of ourselves
and each other,
and it kind of goes into constantly checking in. We have a motto that we operate here is colleagues, not competition. We're both very competitive individuals, and we've had to put that competition aside in order to make this work and keep the patient at the center of the attention.
Right. And we're in a multi-specialty complex. We're called the dental specialists. We're the surgical branch of that.
Hey.
And trying our absolute best to always put the patient first, to look at it as far as periodontist and oral maxillofacial surgeon coming together as appropriate.
So we try to celebrate our differences here. And, I'm a young female, I'm short.
Are you saying I'm old?
Periodontist.
Is that where we're going here?
He's an experienced oral surgeon. He's a guy, he's a tall guy. And so we've got a lot of differences right from the start, but we also both have a lot to bring to the table. And the challenge and the opportunity that we have explored with this model of Perio and OS together is a collaboration. And it's been great. The results, our patients love it. We like it when we're hitting the right stride on the right day.
It's nice when you can put your ego aside and it's a constant sort of thing, a discussion on the front end, and say, I'm going to bring Dr. Ganter in to take a look at this.
Yes. And so that's what kind of running through the main things that we get asked all the time by people who are curious about the model is, how do implants work? You guys both place implants. Right. How do you do that? We say refer to the practice. That way your referral doesn't have to choose who they're seeing. Sometimes that can, especially for someone like me, a new doc in the practice, no one knows me and I have to work to start to get that referral base. The nice thing about having the other side of the equation, the other doc in the practice, kind of share referrals, and we all just kind of refer to one big practice. And a lot of times we see complicated cases side by side, giving a perio and OS perspective.
And as long as everyone's busy enough, and quite frankly, as long as everyone's making enough money and feeling professionally satisfied, then it can work. But there can be challenges there to talk through, and it's a work in progress. It's something that takes time and attention.
Let's also talk about how our specialties view this. For me, my specialty, it was tricky, when I was in residency and I was telling my perio faculty, hey, I'm doing this, some of my residents were actually like,
Like, you're bonkers.
so hold on, the residents, my co-residents were like, that's awesome. We are
Mm,
so excited for you. Kind of a newer mindset. My faculty were plus and minus on it, and that's
yeah.
understandable because it's not every day you see this, and there's a lot of challenges and egos there.
And I think as you and I have talked about, it is a model that's going to likely increase. There are certainly some big benefits from a patient care perspective, from a practice, from a business perspective. Uh, and I think this is the direction that things may end up going.
Yeah, it's great. I mean, if you look at the American Dental Association is doing a big push for all models in private practice, or if you're doing corporate, associate, owner, anything. And so when you look at that, even DSOs are kind of embracing this model. So it's coming around, and you might as well get on the front end of it, partner with a periodontist or an oral surgeon in your area,
Yeah.
and use it instead of be afraid of it.
And I think one of the things that I like, and I love that Amos has given us the opportunity to speak at the Dental Implant Conference. I had a
Yeah,
chance to talk to their board of
yeah,
trustees and some other state
yeah,
leaders and said, as a specialty, we need to reach out to others. Things
yeah.
are better when we work together, when we're part of the solution. And so kudos to them for allowing us to present at the Amos session together.
Absolutely, nothing but gratitude there. And whenever you can try to find ways to work with each other, our product is better. If you think that part of implants, for instance, to throw that example out again, you have a lot of general dentists placing implants now, which it is what it is. And as a specialist, if you're not placing perfect implants or
Yeah.
near perfect implants, why would a general dentist refer to you if they can do it better?
You're right. And one of our mottos here in the practice is working better together.
Yeah.
Part of this YouTube adventure that we're on, who would think that, did you ever think as a periodontist, you'd be having a YouTube channel called Between Two Teeth in concert, in conjunction with a OMS?
Of course not.
Yeah.
Like none of that was planned.
And sometimes
Eh,
you got to follow the universe on things like that. Anything to
yes.
close things up?
Yes. What's the most annoying thing about working with a periodontist? I'm gonna tell you what's the most annoying thing about working with an oral surgeon.
Suture material and numbers of sutures placed.
So working in your office as an established oral surgery office, coming in and trying to have staff understand there are so many different things, instruments with perio, and there's not just an elevator,
Right.
forcep, and that's it. And it's just and that was my
Yeah.
most challenging thing. And so really laying the groundwork, not just for the oral surgeon, but also staff. And then as from my perspective as a periodontist, I love when you build me up in front of everybody else, because what that does is, especially for the newer doc in the
Right.
practice, I'm not talking perio, just newer doc,
Newer docs.
it helps everybody kind of get behind the practice, not a specific doc.
And working with you has made me a better surgeon.
Likewise.
And my staff will often hand me, say, would you like some of Dr. Ganter's instruments? And so they will hand me your Orban,
And
for
likewise, I
instance.
get staff in the room
Yeah.
saying, "Hey, you want to get Dr. McNeill on this
Yeah.
case?" I'm like, "Absolutely."
Yeah. So if you like what we're talking about, please hit subscribe. Give the OMS/Perio model a go.
Yeah, and even we've kind of taken it to the extreme where we're in the same office, literally, kind of battling every day and working together every day. But even if you have a periodontist next door to you or down the street,
Yeah.
don't be
That's
afraid
a good
to
point.
walk in the office, say hi, say,
Yeah.
"Look, let's lay it out. How can we work together here and
Let's help each other
help
out.
each other out?"
Okay.
Thanks, guys.
Thanks, guys.